Hi, I'm Roger.
Are you the doctor?
Not technically. It says here you've got an earache?
Yeah, my ear has just been...
Shh. It's okay. It's all going to be okay. We'll take good care of you. Give me your wallet.
Oh, yeah, okay.
Oh, I see you have Horton's unrivaled recuperation treatment insurance. The Insurance Goblin will be pleased.
The Insurance Goblin? Okay, what the hell is happening?
Just feeding the Insurance Goblin so he doesn't get too cranky.
But I just paid you, and I'm all paid up on my insurance premiums. Why are you giving that thing more money?
Well, you were just paying me against your deductible. A healthy Insurance Goblin needs a balanced, complete diet. Not just of premiums, but also co-payments, co-insurance, out-of-pocket minimums, and other made-up terms he invented.
Then what even is the point of insurance?
Horton's unrivaled recuperation treatment insurance negotiates with hospitals for lower rates. Without insurance, you couldn't even afford to look at a hospital. Looks like a simple infection. We can treat it easily with a round of antibiotics. No? Okay, actually, your ear is completely fine.
What just happened?
The Insurance Goblin says you don't need antibiotics, so it refuses to cover them.
Does the Goblin have any medical training?
Not in a strictly legal or real sense, but it did outsource this decision to some med techs who reviewed your diagnosis for an entire few seconds before going against the recommendation of a trained doctor who actually spent time in the same room with you.
That sounds bad.
Well, would it make you feel better knowing that for sufferers of rheumatoid arthritis, insurance coverage requests for medication are denied so often, 78% of physicians say patients abandon their recommended treatment altogether because they can't or don't want to pay out of pocket.
No, that doesn't make me feel better.
This might help then. While insurance won't cover the antibiotics, it will cover the Aerotron 69,000 Mega Turbo Edition. Yeah, this baby set the hospital back $50 million and costs $10,000 per use. Also, every time we fire it up, it kills a panda somewhere.
Okay, but how is that covered by my insurance, but a simple round of antibiotics isn't?
Look, I'm gonna level with you. This doesn't really cost $10,000 per use. We just made that number up so we could tell the Insurance Goblin that it's getting a huge discount when we only charge it $5,000.
What? You just said insurance covers this treatment.
It sure does, and it's getting a heck of a deal on it. But while most of this hospital is in your insurance network, the person who handles the ray isn't. See, about 16% of all hospital visits in the U.S. result in a surprise medical bill.
But that guy was here for like 2 seconds. How much can that cost? How?
Remember what I said about making prices up? We do that for pretty much everything. In most countries, the price of a hospital visit includes basic services like staffing, alcohol swabs, or stitches. But here, we nickel and dime and $1,000 you at every opportunity. We inflate our prices to ridiculous levels, then cut hundreds of side deals with insurance companies, meaning there are usually dozens of different prices for an identical service. A blood draw can cost over $1,300. A single IV bag has been $137. And a codeine pill that goes for like 50 cents at Walgreens will cost $20. None of these prices are made up, by the way. I mean, they are made up, but they're also real prices that real patients have been charged in real U.S. hospitals.
How is the government allowing this? Why aren't they doing anything to stop this?
You know, there's actually an interesting story behind this. In order to free up more money for the war effort during World War II, the National War Labor Board instituted a national freeze on employee wages. So instead, companies attracted new talent with better, technically exempt medical insurance plans, creating a massive industry that lobbies and influences government policy. In most developed countries, the government determines the prices of drugs and healthcare, like in Canada and the UK, or negotiates them on taxpayers' behalf, like in Germany and Japan. But US health insurers have cut the government out of the process entirely by arguing that if the government controls health insurance, how long before they control all other industries and federally mandate all ice cream has to include broccoli, and that all wank socks will be made from that scratchy Christmas sweater wool.
Wow, that was actually pretty informative.
Communism.
Communism!
Communism.
So, medical insurance is basically like buying an expensive membership to a pizza place, but once inside, I still have to pay separately for the dough, sauce, cheese, and toppings, making sure I'm always checking that each specific topping is in my plan. Otherwise, I may end up in crippling debt or dead from lack of pepperonis?
Yeah, and best case scenario, that pizza is basically a frozen dollar store pie left to thaw out in a trash bin outside a diarrhea factory. The U.S. taxpayer spends roughly twice as much on health care, but our life expectancy is much lower than in places like the UK, France, or Switzerland. In fact, you're already dead. Time of death, 11:42. Cost of taking the pulse, let's say $4,000, but only $2,000 for you, buddy. I'm Roger, by the way. Oh, I'll email you the bill for this consultation.